Hello, I am submitting this video for the assignment that was the Healthcare Associated Infection Discussion Board MBO-2 for which link in the chain I would break. The one that I can most identify with currently at this point in time is the nurse that was sitting at the nurse's station. She was overwhelmed. She was working on multiple things, had a lot of stuff on her mind, a lot of things going, just one more thing to take her time away. That was one of the ones that possibly I feel could have ultimately stopped because of it being a public area. Contamination. It wouldn't take her long to just pick up the cleaner, spray it down, clean it, remind the patient, re-educate the patient on transfers and how she can go from her father's room, helping him, still come outside, interact with the nursing staff, and not have cross-contamination happen. With that being said, there were multiple breakdowns in this one. No hand washing was done. No gloves were worn when touching a patient. Just a lot of small things led up to one really big and tragic happening. But again, I go back to the nurse sitting at the desk. She had time to quickly go get some cleaner. We're talking a couple of seconds. Yes, is it one more thing? Absolutely. But looking at the larger picture, that's the simplest one as far as making the most impact. If she had done that, one, the patient wouldn't have, or the lady would not have done it again. She probably wouldn't have worn the gloves out and touched things. Two, the nurse who came and touched the station that she assumed was clean would not have got it on her fingers and then transferred it over to a patient. I'm not saying that what she did without the gloves and things and touching the patient didn't contribute, but cross-contamination, point of contact, cross-contamination picked up, coast, carried to the next patient. Those things I feel would have made a huge impact. Even if cross-contamination did happen, it would have not exposed to the MRSA area. Now, could have been from when she was working with the patient, maybe, who knows. But that's the one I'm going to go with. And how I would break it would be to look at the patient, let them know what they did, immediately go and get cleaning agent, clean the area, and have the patient go back into the room, discard the gloves, wash her hands, and then, of course, provide follow-up with the nurse who's with that patient to let them know what happened. In addition to that, let the staff know that the area was contaminated and it has been cleaned. Thank you.